This podcast is brought to you by the Wharton School at the University of Pennsylvania. We mentioned before our Twitter poll question of the day, and you can cast your vote on @Wharton Biz Daily. As we are talking about the healthcare industry right now, how important is healthcare to you as a campaign issue going into the 2020 election? The tally on our voting right now, 50% of our votes saying it is a top 3 issue, 20% not too concerned, 20% saying nothing's going to really change anyway, and only 10% at this point saying they consider it to be a top issue. We mention that because the Leonard Davis Institute here at the University of Pennsylvania is going to be holding a conference about the current state of healthcare called Medicare for All and Beyond. It's going to bring together some of the most knowledgeable people in the healthcare sector to discuss many of the issues that face consumers, doctors, hospitals et al., and it'll look at areas like pricing, affordability, policy, and others. Two of the speakers at the conference joining us here today in our studio, Allison Hoffman, who is a law professor here at the University of Pennsylvania who focuses in part on health law, policy, and regulation. And also joining us, Dave Grande, who is an associate professor at the Perelman School of Medicine here at the University of Pennsylvania and also director of policy for the Leonard Davis Institute. Great to have you both with us. Thank you for coming in.
Great to be here.
I guess let's start with the overarching view, Dave, of what we think you hope will come out of having this conference here coming up next week at the University of Pennsylvania.
Sure. Well, 2020 is, I think, a big year for healthcare. So it's important to keep in mind that the Affordable Care Act was put into law almost exactly 10 years ago. And I think in terms of where the national conversation is in healthcare, there's still big challenges that remain. And I think some of the limitations of the approach of the Affordable Care Act have become more notable. So I think affordability and coverage is an enormous issue for the American people right now. I think we see that in a lot of the polling around the election and the concerns among voters today. And so I think if we are going to come up with solutions to address affordability and coverage, that it will almost necessarily involve the government taking on a greater role in healthcare in some capacity. And so most of the conference is focused on some of these critical questions, I think, as it relates to how the government could be involved in developing affordability standards, how we think about paying providers, and those types of issues.
Allison?
Yeah, we're going to be talking about what is on many Americans' minds right now, which is how to fix the problems that we have in this healthcare system. It's really obvious to most Americans that there are two major problems, which is that a lot of people still have a hard time getting access to the care they need. And for many Americans, and an increasing number of Americans, they can't really afford the health care that's critical to their day-to-day well-being. And so that's the question that frames this conference is where do we go from here? Do we build on the ACA? Or, is it necessary to fundamentally change this system to fix these problems?
So since you look at the regulatory side, I'll ask you this. Do we have the kind of the structure in place to be able to make the necessary changes? Because I think that's maybe one of the bigger questions. It's one thing to want to make the actual physical changes, but I think it's another thing to be able to put forth the change and have Capitol Hill be able to be on board and making the change that's necessary.
We definitely have the structure to make the changes. Where the two greatest challenges are, first, whether there's the will to make the challenges. So if I look at why we're not moving towards something that looks more like Medicare for All today, it's about challenges and political challenges. Why are representatives not willing to make kind of fundamental changes to the system? It's because some voices speak very loud in Washington, D.C., and those voices like the system as is. It's insurance companies, it's large provider networks, it's pharmaceutical companies, and it's that kind of political resistance that causes a problem more than is there the administrative capacity. On the administrative capacity side, it's more a problem of the fact that we have too much administrative capacity, and it would require winnowing out some of those layers that now exist, and that's also controversial. People talk about it in the question of what role would private insurance have in Medicare for All, and they would have less of a role. And so it's what layers of administration can you actually get rid of, and that's a challenge.
Especially when each one of those layers has their own piece of the pie that they're looking to preserve at this point.
That's exactly right.
So, Dave, then when you look at the issues in general, what do you see as the biggest challenges right now for the healthcare industry in the United States?
Well, I think if you ask experts and the public, I think, again, it's like affordability and cost. And obviously that connects directly to people's opportunity to be able to not just access care, but afford insurance. The U.S., again, I'm sure many listeners know this, stands out in the world in terms of our costs. And the main reason we stand out in the world because of our costs is because our prices are a lot higher. If we were to think about tackling that challenge and this gap that I think many Americans see, which is that these prices and costs are growing much faster than their wages, there's really two paths for the country to take. One is the status quo, which is to let a lot of these costs continue to flow, downstream to consumers and let consumers have to sort this out. And, we've seen that to some extent with looking at people with like growing deductibles. And the other path is frankly to look at the government taking on a more active role in looking at the prices of healthcare in America. And, that's not a path that our country has historically taken, but it is the path that most other countries around the world have.
So obviously, I think a lot of people, when you hear them say the government's going to have to do this, they immediately go to the federal government. I'll throw another layer into this. What about at the state level and what the states may want to try and do or can do to be able to have an impact on this as well?
It can be hard for states to do this alone. It's not to say that there's not some important lessons and experimentation that can't happen at the state level. But there are so many, the kind of apparatus that we were just talking about with healthcare, so much of it is tethered to structures and regulations at the federal level that it really does make it hard for states to go it alone and really solve these problems. Now, some states are trying to do things like set up affordability standards of what it means to have affordable insurance, affordable health care. Now, it's a different question of whether or not they're able to actually implement those standards and have them adhered to in some way. And I think that's a harder proposition at the local and state level.
Obviously, during the presidential run-up here, we're hearing different ideas from different candidates at this point. And obviously for Elizabeth Warren and Bernie Sanders, the idea of Medicare for all has been the pitch that they want to go. And again, some of the funding mechanisms are still trying to be figured out as to how they would do it. But can a system like that potentially, do you believe, have an effectiveness here in the United States?
I mean, I think it comes back to some of the things Allison was bringing up, which is it's a huge political shift for the country to have this conversation, because it essentially means taking the way we finance healthcare and moving it out of the workplace in terms of people's wages, moving it out of their household budgets in terms of out-of-pocket spending, and moving it into the tax system. If you were to look at how Bernie Sanders would like to do things, he would like all the financing to happen through the tax system. And therefore, how we think about those costs being experienced by people of different means is going to very much depend on how those taxes are structured. I think there are other ways to think about Medicare for all financing that need not necessarily put the whole entire thing in the tax system, but that's a pretty big shift for the country. And so you have to overcome, I think, some of the natural ways in which taxes are talked about in politics in America to really be able to go down this road.
Yeah, because, Allison, in many people's belief, I think tax is kind of a four-letter word at this point.
Yeah, and I think that's where Elizabeth Warren got into trouble when she got into the details about financing. If you ask the question, would Medicare for all be good for Americans, the answer to that is uniform among experts. And the answer is yes. It would be highly beneficial. As we look at other countries' systems, they do a lot better in terms of what they get for what they spend than we do. As Dave was saying, the transition from here to there is really hard, and shifting dollars around and people understanding that, well, your taxes may increase, but you're now getting more in cash wages than you did before. That's way too complex of a topic to be talking about on the campaign trail. And so it's really, how do you help people understand at the end of the day whether they're going to be getting more for their dollars in healthcare when the accounting is really quite complicated.
But even the difference in size with some other countries that may have a plan that's similar to that in comparison to the size of the U.S. system, that really doesn't play a component. That kind of the fundamentals really say that something like that could work.
the fundamentals say it could work. It's so much more streamlined. There's so much less administrative work to be done at many different layers. If the federal government has the will to push back on prices, which is part of what needs to happen, that would be highly beneficial in terms of total spending. There are pieces that are more challenging for sure with a country as large as the United States, but all of our peer nations do it.
And I guess it's both kind of a short-term and long-term issue as well, correct?
It is, absolutely. It is a question of where the best place for the health system would be 20, 30 years from now is the longer term question. Yeah. And then the short term question is, can we get here from there and how to do it?
So Dave, on the health system side, can we get there from here?
Yeah, I think, again, we have a very robust healthcare delivery system in this country. We also already have a relationship between the federal government and providers through Medicare as it exists today. There's a relationship between Medicaid and providers at the state level. So there already is a lot of kind of the delivery system is well in place. As Allison was referring to earlier, some of the administrative infrastructure the foundation is there to build on. I think, again, like the big question is really one of politics. And, I think that, if candidates were to have put Medicare for all on the table, like when Barack Obama was running for president, I think it would have been a much harder sell than it is today. I think what you're seeing is more appetite, at least for the discussion, because of people's frustration with affordability. And I think from a political standpoint, the big question is, like, the 2016 election had a lot of unpredictable things that happened.
Sure. Yep.
And so I think the question is, like, have the rules changed in politics enough that these bigger ideas have an opportunity to move forward or not? Well,
and Allison, the panel that you're involved with is titled The Value of Choice, which obviously choice is been a topic that has been bandied about in regards to healthcare for, it feels like almost a decade at this point.
It's been many decades. In my work, I write about this, and I think about how individual choice defined as how people make market choices, how they choose among insurance plans, how they choose among doctors, how they choose among hospitals, pharmacies, MRI, imaging centers. This has become kind of the core rhetoric in the healthcare policy debates and in the regulatory system as well. We've built a kind of a massive, what I call a market bureaucracy to think about supporting these kinds of choices. And so the panel that I'm going to be moderating is asking, is choice really so valuable as we've made it out to be in this conversation? And if so, in what regards? And pushing back on the idea that, choice is the end-all and be-all in all situations, and trying to think about it in a more nuanced way. So the panel will have a number of different experts that come at this question from different disciplines and with different methodologies to work through how valuable should choice be, how much should it be elevated in the policy conversation.
You're listening to Wharton Business Daily here on Sirius XM 132. Dan Loney in our studios here in Philadelphia, along with Allison Hoffman, a law professor here at the University of Pennsylvania, Dave Grande, who is with the Perelman School of Medicine, and also the Leonard Davis Institute, talking about the conference that they are going to be holding here coming up in just a few days. That conference titled Medicare for All and Beyond. It is kind of interesting, though, that knowing the change that we know needs to occur, unfortunately, right now, what basically it comes down to is who's going to end up being in office come November. And that's going to determine which way we go coming up for the next 4 years.
Well, that's part of what will determine it. Also, what Congress is willing to do and not willing to do will be highly determinative. Even if somebody like Bernie Sanders is elected, if Bernie Sanders can't get Congress to go along, then Medicare for All will be nothing more than kind of an idea on the campaign trail.
Dave?
Yeah, I agree. I mean, I think it's easy to, put all the eggs in the kind of presidential race. Obviously, that's incredibly important. And, even again, depending on the composition of Congress, I think it will, who ultimately emerges victorious, if they come from the Democratic side, will probably shift the debate a little bit further to the left or to the right in terms of the starting point of a healthcare reform debate. I think that there's broad agreement on the Democratic side that the ACA, at a minimum, needs to have some fixes to it. And so even the contour of what those fixes might look like would probably hinge a little bit on who's victorious.
I don't think there's much doubt about that. In fact, Ezekiel Emanuel, one of the framers of the ACA, has come on this show and said that he even realizes, looking back, that there are things that now he would tweak to the ACA, understanding how some of the components play out. And I guess to a degree, that's part of this process is you can put something kind of in place and ready to go, but until you actually see it working, that's only truly when you know where the potholes may lay.
Yeah, absolutely. And I think, again, if we were to look at what's happened to health insurance premiums with the Affordable Care Act, I think, for example, we see a big problem that what happens when you get just above 400% of poverty and you go from getting subsidies to go buy health insurance to getting no subsidies. So that's about $100,000 for a family of four. So you go from being somewhat insulated from the full price of insurance to completely exposed to whatever is happening in the market. And so there's, the absence of kind of a glide path for those subsidies at that point, I think, is a big issue. The other big issue, I think, is that, we see people needing to manage deductibles that are unmanageable, I think, for many of the people buying these policies. And I think a lot of the candidates who are focused more on ACA fixes are really looking at increasing the generosity of those subsidies, increasing the overall actuarial value of the policies that people are getting, and then, again, trying to address this issue of people who make more money than 400% of federal poverty. How do we extend subsidies into that population? And those things all would do a lot to, I think, address issues of affordability, probably continue to leave some pretty significant gaps in coverage that I think Medicare for All would address, but I think would be a positive step.
Allison?
I agree. What Dave is talking about is looking at how the ACA has rolled out. What can we fix now? And some of those pieces were anticipated. They were political compromise when the law was passed. What's really interesting is seeing how the law has evolved in ways that were unimagined, seeing how contentious the individual mandate was. And now in retrospect, looking at it and saying, was that necessary? Was it advisable? Looking at how the Supreme Court rendered the Medicaid expansion in the states optional and what that has done for some people right at or near the poverty level in terms of their access to coverage. And that's one of the populations that the ACA was explicitly intending to ensure coverage for. And, the way that it rolled out over time was perhaps unpredictable at the time it was passed. So there are pieces that now need to be fixed that were anticipated, and then there are the pieces that you could never imagine at the time a law was passed.
So when doing an event like this, and obviously you're getting the wealth of knowledge that you will have coming here to the University of Pennsylvania on this topic, what do you hope comes from doing a conference like this?
Well, I hope for my panel that we have a real conversation around how much we should be talking about choice, and that's provocative for the members in the audience. So when we think about who's going to be in the audience, it's going to be people who are academics, people who are in the industry, people who have the ability to shape policy going forward. And my goal for this panel is just to prompt them to take a step back and to think really, what is choice worth and where should we be pushing for it, and where are there other priorities and values that should be more important than choice? If that's what my panel does, then I think it would be a huge success.
Dave?
Yeah, and I think, again, as I mentioned earlier, a lot of the conversation is really focused on these key design questions. And so, if we were to think about how to introduce measures of affordability into policy, that was kind of made up in the Affordable Care Act. There wasn't a lot to go on. Yeah. And I think, what evidence can we bring to bear? How can we kind of resolve some of the debate that happens around that issue? How do we understand if we're going to move into more regulated prices, like what's the right way to do that? What kind of levels does the healthcare industry need so that we're not, really strangling the healthcare industry and its ability to deliver care? So I'm hoping that, as Allison mentioned, that we have some really provocative discussions, but then, the Leonard Davis Institute wants to try to see what kinds of ideas we can push forward that, again, is not about supporting Proposal A or Proposal B, but is really trying to advance the conversations that I think exist underneath all the proposals.
I think that's the biggest element to this is finding whatever the right paths are. And it may be a variety of different ideas from a variety of different countries across the world, but getting the best ones and putting them together and seeing how they work together.
Exactly. And I think, even if I look back at the Affordable Care Act debate, there's these really public, visible debates that people get into big fights about.
Yep.
But what's missing from the public conversation is a lot of these nuances that matter that ultimately will impact, I think, like how affordable the health insurance is in the end for people. And people often miss some of that part of the debate.
Great having you both with us. Thank you for coming in.
It's a pleasure.
Thank you. Allison Hoffman, a law professor here at the University of Pennsylvania. Dave Grande from the Perelman School of Medicine here at Penn, and also Director of Policy for the Leonard Davis Institute. To keep engaged with Wharton Business Daily and other Wharton School shows, visit businessradio.wharton.upenn.edu.